Now moving on, stakeholders have made case for access to health to reduce avoidable deaths in Nigeria. They argue that primary health care enables health systems to support a person's health need, from health promotion to disease prevention, treatment, rehabilitation, palliative care, and more. Noel Samson reports.
Health, they say, is wealth. But access to health in Nigeria could be difficult or expensive, particularly for the rural poor. The four major pillars of primary health care, they say, should be made available are community participation, appropriate technologies, and support mechanism. But the question to be asked are, what is the state of primary health care in Nigeria, its availability, and how affordable it is?
80% of Nigerians are supposed to have access to primary health care, whereas 15% perhaps will graduate to secondary health care, and then only 5% will graduate to tertiary care. Right? We are talking about complications and stuff, at the tertiary level. But for us, there is PHC transformation, massive one currently ongoing.
First of all is access to services, which is again an issue for everybody. I think we should be able to provide service to everybody whenever and wherever they are.
It's not in the state that you would expect. Whenever people are ill, the first port of call for them to access healthcare should be primary healthcare. But there have been concerted efforts by the government to improve services in primary healthcare.
There's been a lot that's been tried, and yet some of the primary healthcare outcomes we've not achieved what we'd like to achieve. And we're asking ourselves the question, what is the issue? What is going on? So structurally, I think there is some progress to be made, but there are quite a lot of behavioral factors at play as well.
However, strategies to be adopted to make primary health care services more friendly to people were highlighted.
No community is the same in Nigeria. No state is the same in Nigeria. So we'll have to start with, first of all, that agree what is affordable and appropriate to the context of each setting.
The responsibility of every Nigerian to ensure that you support the current initiative of primary health care transformation in the country. One, demand side issues. People should demand for primary health care services. The current revitalization, the World Development Committees will be available, and these are the gatekeepers will ensure functionality of these primary health care centers.
The financing will enable more people to have access to it in terms of their access to basic services. The human resources for health, of course, is an important aspect.
We need a lot of stakeholder engagement. We need to better understand what services that people want and how they want it.
Primary health care helps to increase access to health services, which is particularly important for isolated or deprived population groups that may not have the means to access these services otherwise. Noel Samson, Trust TV News, Abuja.